Hi, and welcome to the Skincarma Pod. I'm Carmine, the creator and voice of the Skincarma blog. With more than 25 years in beauty as a brand builder, copywriter, and skincare junkie, I'm putting my product wisdom and expertise to work demystifying skincare. On today's episode of the Skincarma Pod, I'm joined by Brian Ecclefield, founder and managing director of Validated Claim Support, the clinical testing lab setting new standards for ethics, accuracy, and transparency in cosmetic claims. Few topics have shaken the beauty world this year like SunscreenGate, the scandalous revelation that the SPF validation test behind many popular sunscreens may have been manipulated, falsified, or simply fallen short, leading to careless, even dangerous mislabeling and haphazard sunscreen product recalls. There's nobody more uniquely qualified to explain how we got here and where we're headed than Brian Ecclefield. For more than 16 years, Brian has designed and overseen clinical studies for skincare, hair care, personal care, and OTC products like sunscreens. He specializes in the rigorous evaluation of claims, including the complex world of SPF validation. Before launching VCS, Brian spent time inside two of the industry's most relied upon and infamous labs, AMA and Princeton Consumer Research, giving him rare insider insights into how testing can go wrong, how numbers can be massaged, and what red flags brands should never ignore. As SunscreenGate has exploded over the past several weeks, I've been eagerly anticipating this conversation with Brian. So let's get to it. Let's hear from Brian. Brian, hi.
Hey, Carmine, how's it going?
It's going great. Welcome to the Skincarma Pod. I guess you're hovering there over the Hudson River.
Yeah, I'm at the Inc. 48 Hotel just getting ready for a big gala with the New York Society of Cosmetic Chemists tonight.
Very exciting. And what's going on there?
It's the awards night for the year, and they're also bringing on the new executive board, which I'm proud to be a part of as the incoming treasurer.
Wow, that's amazing. Congrats.
Thank you.
They could probably really use you. And we're going to get
I
into
hope so.
exactly why that is. So let's start. I think most listeners, and it'll be in the title, of course, are eager to hear about SunscreenGate. But before we talk about that, I want to hear from you about who you are, where you hail from, share your career path and how you
Mhm.
became one of the leading experts in claims testing.
Sure, I'd be happy to. So, I've now been involved with clinical studies and claim support testing for the last 16 and a half years.
Mm-hmm.
I came from two different laboratories where I left citing extremely unethical practices with both sets of owners. Those companies are AMA Laboratories and Princeton Consumer Research.
Mm-hmm.
So I had a long time working at both of those places. Well, a long time at AMA Laboratories, about 10 years. And then I went to work at PCR, saw some things that I basically kind of recognized as patterns which I was not so happy with, and
Yeah.
data which was potentially too good to be true. And instead of going back to work for another big multinational claim support lab, I decided to start my own. So I created Validated Claim Support. That's
Mm-hmm.
back in 2018 into 2019. And today, we're a clinical support laboratory that specializes in expert grading, biophysical instrumentation, before and after photography, and consumer perception studies. So, sort of combining all of the different in vivo facets for personal care.
Got it. So your lab VCR and right VCR
VCS, Validated
VCS,
Claim
sorry,
Support.
VCS, and the other labs that we're mentioning.
Mhm.
You do claims testing, but you also do clinical studies and consumer perception studies. Am I getting that correct?
That's correct. A lot of times when people talk about claims, they're coming from either consumer perception or the clinical side, which would be objective measurements on the
Right.
skin or the hair.
Right. So we're talking about two very popular tests in consumer product marketing. One is, if we're testing an anti-aging cream, it's evaluating that the formula is minimizing the appearance of wrinkles by 18%. And then there's the other less expensive study where, they're called consumer perception studies. It's that brands love because they're not as expensive and the results are much higher, where,
Yeah.
98% of women said that the product hydrated their skin instantly. And I like to joke that you could ask 50 women in New Jersey if applying Jello to their face was hydrating, and they'll all tell you it was hydrating. In the next sentence, they'll tell you that it was sticky and uncomfortable. Um,
Right.
right? So, I don't know. I'm kind of always suspicious of those tests. The clinical studies, of course, and then the most important study of all is the SPF validation, which we're
Hmm.
going to get to. So, you at VCS, you talk about challenging the CRO status quo. Can you
Hmm.
tell us what a CRO, or contract research organization, is and the role that they play in product development?
Absolutely. So, CRO, or a contract or clinical research organization, depending on who you ask, is an institute that provides third party, unbiased research to brands and manufacturers of products across all different industries.
Hmm.
In our case, we're specializing in beauty, personal care, makeup, cosmetics, and some OTC products as well. So, brands will come to us to, like you were kind of alluding to, prove how well their products actually work. And I
Yep.
think something kind of funny based on what you picked up on is you have to go into the study with the right questions in mind.
Yeah.
If you ask the right questions, you're more likely to get a positive outcome. And one of the things that's really interesting is, like you're saying, how many questions have to go poorly before you get to that 92% agree on something positive. So those are definitely interesting topics to chat about.
They are. And you know why? I have a particular insight into that because I've written those questions
Hmm.
for those studies, in-house at brands. So we've come up with 25, 30 questions. So I know how craftily they're phrased. And which is basically why I'm not a big fan of consumer perception studies, because I know personally how brands manipulate those results.
Totally.
Yeah. And so I know you've established VCS on three pillars, the to be more ethical, accurate, and transparent. Can
Hmm.
you, maybe even in relation to your past experience, can you share what that means in practice, particularly how a lab can be more transparent and how transparency works differently for VCS?
Absolutely. Some of the things that you can do as a lab or as a brand who's qualifying a lab, you should be looking at registrations and certifications and compliance. So, the first thing you should be able to do as the lab is establish an FDA registration identifier of some kind. That can be found on the FDA's website under the current drug establishments page. So, no matter how big your brand is, if you're looking to sort of build up a vendor application process for a new CRO, you should be going on the FDA's website and searching for a registration for each of the sites, which is going to be testing your product. That's one simple way. Another way would be the other labs I've worked at always paid their participants in cash.
Mm.
So volunteers who are testing products are getting paid cold hard cash. And cash is something which can always lead to the potential for corruption. It's hard to trace. And some of the things which AMA Laboratories was doing involved paying people less than $600 per year across a wide spectrum of participants so that they never triggered a 1099 reporting requirement. So basically, what they were doing is they had a huge database of people's names, addresses, and social security numbers, and they were able to conduct this testing by keeping it sort of under the radar from a tax perspective. Then, because it's cash, the owners of the company can retain that cash since they never had to pay it to participants who weren't on the study in the first place. So it's sort of a big fraudulent cycle. So ideally, your lab should not be paying cash. There should be some type of digital transaction which is traceable in some way. And then thirdly, I would say it's really important to be truly transparent. So invite site audits.
Hmm.
And not every brand is going to have the financial ability to send everyone on their team out to conduct a quality audit. Could be on the other side of the world. But there's a lot of very reasonably priced third party auditors who you can hire to do FDA or international standard audits on your behalf. So get somebody to the site. And if people are keeping doors closed on you on the physical site, that's a problem. But you want to see the equipment with your own eyes. You want to see participants coming in and out and get a feel for the day to day life at the lab.
I'm so glad that you brought that up because I was just on a webinar that was kind of focusing on this topic exactly. And, they were saying a lot of the same things, and I'm screaming into my mic. I'm sure I was muted. Like, people don't know what they don't know. A lot
Mhm.
of brand founders have no idea how lab testing works, particularly SPF lab validations. And even having someone on their team go to an AMA or a PCR, or even to
Mhm.
your lab, how do they even know what to look for? There's like probably 100 things that could be red flags, but I wouldn't know that it was a red flag. And one of the things I thought was really interesting, this was a woman who I think she might be a co-founder of one brand, and she actually is also a formulator herself or a scientist of some sort. And she was talking about going to a lab in particular, and the red flag for her was that they didn't ask her to put a hairnet on as she was looking around the lab and actually looking over a keg filled with
Mhm.
product, and that was a red flag for her. Like, if I hadn't worked in house at L'Oreal and been to the lab and known that that was how the process worked, I wouldn't know that that was a huge no no. Because she was like, "How do I know they're not having people come, hovering over my vat? Like,
Right.
how does a how is the solution really for you for a brand to hire someone like you said who really does know how to do that sort of thing and know what to look for?"
I think it is, to
Yeah.
be totally honest, because like you said, founders can't always do everything. As a founder, I know how many different directions you could get pulled into, but even like a quality manager on my team wouldn't know the first thing about a packaging or a labeling facility because that's not their expertise.
Yeah.
So if you're coming from the brand side, if you're in a really big company, there may be a department that's dedicated to doing external audits, but ideally you're going to want somebody who does know what the red flags are and what to look for, and you're going to save yourself a lot of time and headache if you hire an external third party to do that on your behalf.
Right.
I'm not saying they shouldn't go necessarily. Like, it's great to be there with the auditor because then you can learn where they're poking holes
Oh,
too. So
sure, yeah.
that's
Go
that's a great
together.
sort of hybrid. Go
Yeah,
together. Yeah.
yeah. Okay, so let's rewind a second. You left AMA over ethical concerns. You later
Mhm.
joined Princeton Consumer Research, or PCR, only to encounter eerily familiar red flags. Both AMA and PCR are names now synonymous with the data manipulation that's led to the SunscreenGate scandal. When you look back on those experiences, maybe without naming specifics that you can't disclose, what do you see
Mhm.
as the deeper systemic issues?
So everything goes back to this underlying concept that if you use less participants or you extrapolate data, it saves you time and money. That's half of the problem. The other half is that there's immense pressure in the industry to do things faster, cheaper, and better to hit certain timelines.
Mm,
So those two things in their own special way compound, and if you have a bad person who's in charge of a company and they start cutting corners, that can actually create a huge competitive advantage because these labs are able to do things faster and cheaper, which should be impossible But then they tie that third piece on and they're providing higher results at a cheaper level on a faster timeline. So, I mean, I've heard so many times in my career, why would we come to you at validated claim support when I could go down the street over there and I can get higher results next week at a cheaper price? And it's a very difficult question to answer until things come to a major regulatory hit.
Right. And do you wait for them to come back across the street?
Some of them have. I mean, I'm not the kind of person who would ever try and say I told you so.
Right.
But, if anybody's listening out there, just remember, maybe I did.
Keep my number.
Exactly.
Right. All right. So let's get into SunscreenGate and what went wrong. I think you know that I came across your efforts to expose the flaws in the claims validation process through that Beauty Matter article titled "The Real Sunscreen Scandal Isn't in Australia, It's in the Lab." Beauty Matter's investigation revealed SPF results ranging from 4 to 64 for the same formula, a staggering inconsistency that regulators sounding alarms and consumers more than a little concerned. From your vantage point, how does something like this actually happen inside a trusted testing lab?
First and foremost, what we're talking about is primarily Australian standard testing. So just to clarify, the Therapeutic Goods Association, or the TGA in Australia, regulates sunscreens somewhat similar to how FDA does in the US. So what happened here is that a third-party consumer advocacy group called Choice pulled a number of products off of shelves, and they got them retested on their own to see if they're holding up to what their purported label claims of SPF 30 or 50 may or may not sort of hold up underwater. So they get the secondary testing done. And unlike in other years where a handful of products came back undervalued, the majority of the products came back undervalued. And many of them had been tested by the same laboratory, in this case, Princeton Consumer Research. I think what really led to this particular instance getting all of the headway that it did was not everything, a lot of these products trace back to the same lab, and then the purported testing difference from a 4 going to a 50 is a staggering gap in efficacy. We're not talking about hydration or barrier protection. We're talking about sun protection and UV protection, stopping aging in its tracks and the potential for skin cancer over time. So because there were so many products that were traced back to the same CRO, it immediately became a big issue. And then, unfortunately, Ultraviolet kind of doubled down initially on their testing, and they submitted a secondary report from Princeton Consumer Research as a backup. Then things completely exploded.
Right, and Ultraviolet is an Australian brand that's recently launched in the United States, and I actually am obsessed with one of their sunscreens and have no idea if the labeling is accurate or not now. Maybe that's why I love it so much.
Right.
So interestingly, you've called out 100% effective results as a major red flag. In fact, you said if results show studies that are 100% effective 100% of the time, you should question them, and the brand and consumer should question them because nothing is 100% effective. So why are perfectly concise SPF scores specifically scientifically implausible? Like, why is an SPF 50 potentially not really an SPF 50? Like, how does that process work?
As we're talking still about Ultraviolet, I would definitely want to state on the record that I feel bad for them. I feel for them the way that this kind of went, because they ended up sort of catching the brunt of it.
Yeah.
And they actually did the right thing by initiating voluntary recalls after the fact, once they sort of realized there was a real reason to question things. So I did want to just make that caveat on their behalf.
Yeah.
So the test scores, or the results that are related to this product, or this formula, which was most questioned, the methods for SPF testing clearly define that you're going to do an unprotected minimum erythemal dose, or UV dose, on people's skin. You evaluate it a day later, and then that same day, you're going to put the product on, apply it, and compare the reaction time. So, like an SPF 15, effectively, it's 15 times longer to show redness. It's
Uh-huh.
clearly defined. You have to look at this 24 hours later. In the Princeton Consumer Research reports, they were actually looking at the skin 72 hours later. So you can imagine how quickly a sunburn fades. A complete either
Right.
negligent act or omission or purposeful, conduct of that nature, that would lead to a huge gap in what the protection is versus what the label is.
That's crazy. Like, of course the redness has gone down. They were exposed to UV for how long?
Usually it's not about the time, it's about delivered radiation doses.
Okay.
It's equivalent to they say like, 16 minutes in the midday sun is like one standard erythemal dose. It's different for every skin type, but just say for argument's sake that it's about the level of radiation delivered as opposed to time.
Okay. Okay. That makes sense to me then. Wow. And what do we think? Like, why would a testing lab use a 3-day parameter when I don't know, is it a monograph, is it protocol, like, whatever the FDA regulation says that it needs to be within 24 hours? Why would they go outside of that?
In this particular instance, it could be a negligent act or an omission, but their protocol. So the way it works is the regulatory body, in this case, the TGA, they provide a monograph, like you were saying,
Right.
and each lab will write its own protocol, which ties their procedures into the monograph. So the monograph says 24 hours. The PCR protocol says 24 hours. However, the data and the study schedule show 72 hours. So either somebody didn't properly enact the protocol or it was done intentionally. In this case, I would actually lean on the former. I just think that they were negligent in their responsibilities. And then three other individuals, including the one of the owners of the company who signed off as the principal investigator and the quality manager, all signed off saying this protocol was conducted correctly when
Mm,
it's clear as day that it wasn't in the data.
right. Right. And so therein lies the issue for a brand like Ultraviolet and
Mhm.
the others that you said that Choice evaluated, right?
Yes, it's really difficult, like we're saying, to be able to sort of sift through that. And I think these reports were public for a long time before any information about the discrepancies in timing values ever came out. I only recognize it because I've lived through this company, in my past, and I know what to look for, having been doing this for a long time. But like I was saying earlier, I have a very targeted niche expertise, and it just happens to be in this exact currently very popular field.
Yeah, right. How many of these testing labs exist?
Not very many. I would say globally, probably like less than 50
Oh,
entities
wow.
who do what we do on the CRO side. And it used to be much more. There's many big conglomerate testing companies
Hmm.
which have been purchasing smaller
And they
labs.
have
So you have,
offices around the world.
yeah, you got three big players called ALS, SGS, and Eurofins testing. And
Hmm.
between those three, they own a huge percentage of the market.
Yeah, and so there's a limited number of these labs doing this SPF validation, but the number of brands needing SPF validation has exploded exponentially. Right? Like, there
Hmm.
seems to be all of a sudden every brand wants sunscreen, and that's great because that means that consumers are interested in sunscreens and want sunscreens and are maybe applying sunscreen more than ever before. So
Yeah.
it seems like there's a big mismatch, and it's possible given that it's just these companies are just overwhelmed. And to your point, I worked in house at L'Oreal for almost 8 years, and I know the amount of pressure everybody is under to launch products on a specific deadline and
Hmm.
a timeline, and obviously, product, their third party evaluators are under the same pressure when we're feeling that pressure in house. And so I could see how they would fudge the numbers, or they would, cut corners, or things could fall through the cracks. But what's so crazy to me is, like, it in the United States, where sunscreen is regulated like a drug by the
Hmm.
FDA, and they seem to be so strict about everything else, down to the lack of innovation. That we haven't had new sunscreen filters, new UV filters in forever.
It's
Apparent
been a minute
It's
for
been a
sure.
minute, right? Like, I think the 90s, I don't know. Um and for this kind of thing to fall through the cracks just cracks me up. Like, I can't even believe, like, I just had this impression that things were much more strict and much more firmly regulated,
Hmm.
and this kind of thing couldn't happen. So it just,
Yeah.
right, it's kind of crazy. It's like, wow, there's a whole, like, there's much more of a Wild West feel to it all than I expected.
Well, I think a lot of it actually comes down to the way sunscreens sort of bridge the gap between cosmetics and OTC drugs.
Hmm.
So each sunscreen itself is not actually a new drug application, it's reusing previously approved active ingredients. So each formula doesn't actually go through as much of a rigorous sort of FDA review as many people probably believe, since you're effectively taking these pre-existing ingredients, reformulating them into something new that's not necessarily all that different from things which already exist, and you're set using specific concentrations of these actives. So there's that, and then there's the fact that from the FDA side, regulation of cosmetics and drugs are done by different letters of the alphabet. So the C is actually a little c that comes under the Food Administration arm of the FDA. The D is really pharma. So
Mm,
a pharma auditor is not necessarily going to know half a thing about SPF testing because they're thinking much bigger, more risky standards. So that sort of issue is a problem too. The way that you're squished in between two branches of the government administration, which really perform very different roles.
yeah. So you mentioned the TGA. The TGA, is it essentially a direct equivalent of the FDA, or do each of them do different things, and this is just where they overlap?
It's very similar for the
Okay.
purposes of with like it for of nuance. It's a government administration which is designed to sort of police what they call therapeutic goods, and sunscreens fall directly into that category. Very similar here from a
Got it.
regulatory
And
perspective.
so the TGA investigation, may just be the beginning,
Hmm.
but I think I read somewhere that PCR PCR's business is only, I don't know, in the low single digit percentages is Australian products. The vast
Hmm.
majority, I assume, of their business is US consumer products, US based sunscreen brands. So, what's coming?
Great question. I would say that a very small percentage, like you're alluding to, of
Hmm.
PCR's sales on the services side were done in Australia. Their primary markets are the US as number one, Europe as number two, and then Asia as number three. So right now, we're also only looking at sunscreen. And in
Mm,
my opinion, if you're gonna fudge data or be negligent on highly controlled and highly regulated standards, I think it's at least worth questioning what your sort of normal acumen and capabilities look like for less regulated things like patch testing, comedogenicidity, let's say skincare, hydration, HRIPTs, and safety testing. So
right.
there's really a lot of other factors and potential markets here which have not yet officially been sort of impacted directly. But I do think it's coming in a big way.
I have to say, yeah, that's so crazy. When I think about skin hydration, and I think the first brand to market a moisturizer that hydrated skin for 72 hours was
Hmm.
that Clinique Moisture Surge. And when they first came out with that ridiculous claim, I thought to myself, unless you're being held hostage, why wouldn't you why wouldn't you be using a moisturizer every day? Who uses moisturizer every 3 days? Like,
Have you seen the 100-hour claims that are on the market now?
see, they
It's so
got
much
they had to
worse.
be outdone. 100
Yeah.
hours. How many days is
Yeah.
that? 4 days? 5 days? I don't know.
5.1 days or
That
something
is
if you do the math,
insane.
probably.
So you can just don't worry about it. 5 business days. You should apply this moisturizer every 5 business days. Like
Yeah. And
it,
meanwhile, you have to go about your normal life. Like you're during that time for these types of studies, generally people aren't showering. So you
mm,
can't wash the site. I mean, that's gross. Like you said, unless it's a hostage situation, what real reason
right.
is there for something like that?
But that's the point you were making earlier about consumer behavior. You know, obviously I'm showering, and if I'm showering, then the
Hmm.
product is gone.
Hmm.
Particularly a moisturizer an occlusive moisturizer that works by, staying on the very surface layer of the skin. Like,
Yeah.
it's unless you're a hostage, and we don't recommend being a hostage, do we?
No,
That is
definitely
not
not.
that is not the best way to improve and enhance your skin health.
Right. And also, as a brand, I mean, not for nothing, but use the opportunity to ensure people are reusing your product so that you can sell more. So I think asking people or telling people they could get away with not reapplying for 100 hours is maybe not the best business decision.
It's not. You really want them using that product every day to get your use up rate. Yeah. All right. So the last question before we do a quick fun lightning round. Consumers are confused, brands are anxious, trust is shaken. In your view, what needs to happen immediately and structurally for the industry and consumers to regain confidence in SPF testing?
Right now, in the short term, consumers and brands need to sort of look at what is readily available. So there is a TGA list of products which you can find online. You can see which products have been connected to these potential recalls and potential illicit testing. So there's a list of certain products right now which you can stay away from in the short term.
Hmm.
On top of that, brands who know that they have tested at companies which are now sort of at least questionable, not to or to use a light word here. If you know you've tested at a questionable lab, I would say it's on you right now not to recall your products, but to retest somewhere else and see if the results harmonize with what you have on your label. If they don't, you should be acting as quickly as you can, either to sort of let that SKU fade out and get it removed from the shelves, or if there's a huge discrepancy for something like SPF and protection, conduct a recall. On the regulatory side, TGA is and has acted already by sort of blacklisting this institute and sending warning letters. I think the FDA should be sending warning letters on its own so that brands know that there's at least an international investigation ongoing into testing conduct. And if your product is affected, you should follow along very closely. Listen to any new recalls which may come out, and most importantly, go get your product retested somewhere else that's not currently under investigation. And then lastly, as a consumer, reapply sunscreen now more than ever,
Right.
because like even with many of these products that were tested by Choice, a lot of them hit 80% or more of their target label claim. There's only a handful that fell out with a significantly lower label claim number. So reapply your sunscreen. Make sure you're using stuff that hasn't directly been sort of called out and put on one of these blacklists. And don't lose faith here. If one of the brands you like is on the list and they recall their products, that means they're doing the right thing. Voluntary recalls mean that brands actually care about the effect before they're compelled to act. So just consider that there are companies here who may have been affected unknowingly, and them doing the right thing is them making a recall.
Got it. So I will try to locate that TGA list and drop it into the show notes. Two things on that. And in your comment. One, do you know if the FDA has even responded to this?
I would imagine they would have had to respond at this time in some way, and that they would hopefully be sort of conducting some kind of investigation on their own.
Ah, okay. And then I guess second, are you aware of any brands coming forward and saying, yeah, we tested at PCR as well and we're looking into it?
For sure. I mean, almost every day I hear people saying, like, I tested at that company. What should I do?
Mm,
And as with many other situations, the first thing to do is get a second opinion right now. It's not necessarily to spend millions on a recall.
right. All right. Let's move on to the lightning round. You're ready?
Ready.
Get your buzzer ready. Your favorite piece of lab equipment.
I'm going to have to call it a multi-port solar simulator.
Can you beam me to LA with that?
No, it's extremely heavy and it will not fit in carry-on or checked luggage.
Okay. The wildest thing you've ever seen in a lab report.
I honestly, at this point, would have to say it's an SPF 50 versus a 4 being on the market. Like, that is a staggering differential.
Okay. If you weren't doing clinical testing, what would you be doing?
Some combination of blockchain backed financial services and IT.
You're putting it out in the universe.
Yeah.
Yep, when you put it on a podcast, you put it out in the universe.
For reference, my undergrad was there, so I ended up in skincare by a very circuitous route.
Okay, a lot of us end up in skincare by accident. I'm with you on that. I had no intentions of going into this. A hobby or obsession that has nothing to do with skincare.
Scuba diving.
Oh, amazing. That's great. Well, the Hudson's right behind you. Feel free.
I don't think I want to go in there, especially this time of year. But honestly, most times a year, that water's not for me.
You might find Jimmy Hoffa at the bottom of the Hudson.
There's a lot of things that nobody wants to uncover right behind me in the river.
It's totally true. One skincare claim that drives you nuts.
It's these long wear claims like we were just talking about, hostage situations and 72 100-hour 7-day usage cycles. There's just no earthly reason for claims like that.
Yeah. Fave skincare product in your routine.
I like the simple sort of daily Clinique. It's a water-based moisturizer, so that's my favorite because it's not very greasy and it's relatively cheap. But most of the stuff that I use that I know works, I won't name by brand just for confidentiality purposes.
Okay, no problem. If you could have dinner
it's called Hydra Boost.
Okay, Neutrogena.
No, it's
Clinique.
Estée or Clinique product.
Oh, got it. Okay.
Yep.
Got it. If you could have dinner with any scientist, living or dead, who would it be?
I think it would have to be Sir Isaac Newton.
Love it. Okay.
We could get a little bit of archery in the way that you check the I think it would have to be Sir Isaac Newton.
Cool. All right, last question. Finish this sentence. If you're not seeing it with your own eyes,
you shouldn't believe it.
Amazing. Excellent. Thank you, Brian. This was quite elucidating. I've been looking forward to this conversation for weeks, as you know, and I really appreciate you taking the time on this auspicious day.
No worries. It's going to be a long night for sure. I think the gala and the festivities finish up around midnight.
Yikes.
So I think there's a Red Bull in my future.
I will be 3 hours. I'll be into REM sleep by the time you get out of
Good for you.
By the time you get out of there. All right. Thank you so much, sir.
You got it.
All right.
Great chatting with you.
Ciao. All right. Thank you for listening to the Skincarma Pod. Find more insights, real talk, and reviews of my favorite skincare products on the Skincarma blog at skincarma.com. And if you're listening on Apple Podcasts or Spotify, please rate and review this episode. It helps me to reach more listeners. Ciao.